Good evening and welcome to this edition of In Focus on Whitewater Community Television's WGTV Channel 11. I'm Eric Marsh, Executive Director of WCTV, and glad you're able to join us for this hour discussion of actually not-for-profit organizations, but different conversations. A couple of them we checked in on a year or more ago, and we're going to do a follow-up on them. That's the Neighborhood Health Center and Independent Living Center. We'll also be talking with some gentlemen from Reid Health here in just a moment, but first I want to start off doing what we always do this time of year, reminding you that you need to be registered to vote. You can do that up until April 6th. Voter registration offices at 301 East Main Street. They're open Monday, 8:30 till 5, Tuesday through Friday, 8:30 to 4:30. But if you really just want to do this easily from the comfort of your home, you can go to indianavoters.com. You can do it on your tablet. You can do it on your cell phone. You can do it on your laptop, whatever it is. You can check your registration. You can actually register to vote if you find that you are not registered to vote. You can do that there, or you can find out where various voting locations are. So, indianavoters.com. If you need more information, there's a phone number on the screen, 973-9226. That'll get us started with that. And please, we'll keep reminding you until you do it. We will browbeat you about this because you have to go get this done. A little bit earlier this week, there was a press release sent out that basically said Reid establishes police force. And a few people went, huh? So we're going to find out a little bit more about that. We've got three gentlemen here who have all of the answers to all of the questions I'm going to They're laughing. We got 27 minutes left to go. You all have to have all of the answers to all of the questions that I'm trying to come up with. You can do this, right?
We have them. Of course.
Okay. Randy Calentis, Jeff Kappa, and Dennis Perkins. Tell us what it is, your title is, what you do.
I'm the Director of Security for Reid Health. I've been there since 2006 after I retired from the Richmond Police Department. So I basically run the physical security department for Reid.
Go for it.
I'm Jeff Kappa. I'm the manager of the Richmond campuses for the security division.
How long did it take you to actually be able to say that without stumbling?
A little bit.
And Dennis?
Yes, I'm Dennis Perkins, and I'm the manager of the Connersville campus for Reid Health.
Okay. Let's start with a basic question. How long has this conversation been taking place about Reid establishing this, and what were some of the reasons it was needed?
Well, the conversation's been going on for probably 4 years. In 2013, the state legislature created the state law 582 that allowed hospitals to create their own police departments. At that point, the discussion kind of started, but seriously motivated over the last 3 to 4 years of putting things together and trying to create the scenario that would make Reid Health fit into that better. A lot of the reasoning behind it is some of the issues that security is dealing with now, some of the community issues that find their way to Reid that sometimes make the environment fairly unsafe. So we just need to step up what we're doing in our training and the trainings that the state offers with this certification, just kind of blended together after that 3-year looking into the process to see what we needed to do to move forward.
When you say that 3 years putting Reid in a position to do that, what type of behind-the-scenes work or what type of conversations were being had to put things in place? What type of things were you trying to put into place to move this along?
Well, initially, staffing was a problem. We didn't have enough staff that we could actually afford to send somebody to an 8-week training session. So once again, though, the crime statistics for our area, the square footage that security covers, and internal issues that we were having with some folks that were coming to the facility, all of that combined to a point where we couldn't move forward with it. So with those issues, we in 2018 we added almost double the staff for security. So we went from 9 security personnel to 18 on the Richmond campus. At that point, it made it a lot easier for us to consider having at least 1 or 2 people off for 8 weeks to training.
And the 8-week training is Indiana Police Academy? What training will they have to go through, and how intense is it?
It's an 8-week training session at the Indiana Law Enforcement Academy in Plainfield, Indiana. It's very intense, and there's criminal law. Obviously, they're on a lot of traffic law and other things that may not come into play for healthcare, but there's a lot of stuff about behavioral issues, training on how to deal with people, and it's just going to be a good certification, combined with some of the training that we use for the International Association of Healthcare Safety and Security, which is directly related to healthcare security. Those two will make kind of the perfect storm for what the officers will be using in their daily activities.
What will be the difference in what the community sees as they walk into any of your facilities, whether it be Connersville, or will this change your security staffing in because Reid's footprint has continued to grow. So will it change what people see in some of those other facilities beyond the main campus? Anybody?
Yep.
I think basically the compassion that you see by the staff every day, the security staff is going to stay the same. Basically what we do is going to stay the same. We're just going to enhance the professionalism that's already there and it's been there by the director. We do extensive training, and we have a very diverse team of officers that do a wonderful job every day at the Reid campuses. This is just going to give them the arrest authority if they need to use the arrest authority to protect the staff member or a visitor or a patient. But other than that, everyday operation is going to basically stay the same.
Now, for us in Connersville, it will increase the presence of those officers that were lacking from before. So it's going to be definitely a positive there.
Okay. I know some people are probably wondering, is what you all are dealing with really as bad as all of that? There's some footage that we have. We were able to do some video work for you all just on some of your security training, and through that we're able to get our hands on a little footage. Ryan, if you don't mind putting that up, we'll and there is no audio on this, and faces are blurred to keep people private, but just to give people an idea of just a sample. And if there's anything you want to add while this is rolling, just throw it in.
You know, what you're seeing here is a scuffle with a patient that was in the process of eloping from the unit. Not common, but not an uncommon thing to have happen at Reid. And it for security, like Jeff had pointed out earlier, it's we are a pretty compassionate team, and that's why you don't see any abusive type things going on there. The officers were trying best they could to get a hold of the person so they could place him back where he belonged without injuring him or themselves. But we do deal with stuff like that on a weekly basis.
On a weekly basis?
Yes, definitely do. Some of the external issues that come into the facility, intoxicated people that we have to deal with occasionally. The big thing for healthcare is that no matter if it's a patient or a visitor that's coming to the hospital, there's always a level of uncertainty for them, nervousness, upsetness. So anytime we deal with a patient or a visitor, we have to keep that in mind because they're already on the edge because they don't know how sick they are. They don't know how sick their loved one is. Mm-hmm. So we have to keep that in mind when we start to deal with somebody that's upset. We just have to try to get on their level, to try to deal with them and let them know that we really do care. Security officers, we are armed, we have a badge, and those things can be intimidating, but we want to make sure that people understand that we're there for a different reason, and we want to help them and try to treat them very fairly, and that's what we try to do with every interaction we have.
The conversation and in the press release, it stated that some of the local law enforcement, Sheriff Redder, Jim Branham, Chief of Police of Richmond, and Chief of Police down in Connersville, were all in favor of this. Were you all having discussions with them about this before this came about?
Yeah. We've had we've had many conversations over the last 3-year period. In fact, I still have a letter from then Sheriff Kappa in support of Reid doing this. But yeah, and the Wayne County prosecutor, the Fayette County prosecutor, we wanted to bring all those folks into helping us make that decision because we need their support. We need to know that they're behind us for that reason and understand why we're trying to accomplish this too. And we have complete support from the law enforcement community and the prosecutor staffs. It's pretty nice to have those letters in your packet to help support that when you're presenting that to the administrative staff.
As the sheriff at that time, what was your thought when you were first approached about this? You knew that there was a law in place that would allow it, but what were you thinking about from an upside or downside being the county sheriff?
I saw no downsides at all in it. Actually, all I seen was positive. Especially when we'd have an inmate out at the hospital and we had staff out there, we routinely, as security division, will go up and help relieve those officers if, say, the officer needs a restroom break or they're having a problem with the inmate and they need further assistance. As far as the police presence, with some of the things that have happened in just our community in the last couple of years, active shooter situations, some other things that have taken place, seconds count and minutes count. And when we have a well-trained staff, and they would have a well-trained staff inside the hospital able to respond to these type of situations with the training they have received and be able to handle them, that's where the seconds and the minutes count. And that's why I felt it was a very positive thing for that to be. We have a very positive relationship with all the law enforcement in Fayette County and in Wayne County. And the support was just unanimous when it was approached by Director Clintus about why he wanted to do this.
Talk about your facility in Connersville, the size and scope of it, how it differs from here in Richmond, and what it will mean for you in the Connersville area and what people will see differently from maybe what they have seen through the years.
Well, right now it is a lot different. Our major areas right now are the emergency department. We still have the 24-hour lab and x-ray area. So our officers will focus on the emergency department areas. We do have several areas that are still open and not occupied, so they're going to have a lot more legwork and a lot more footwork until we can get some other things secured. Now, once that is complete, then they will see a big change, because then people will not be able to just walk around and be able to explore the hospital without being escorted or being able to do things that they have currently been able to do. So it will make a big difference. At that same time, it will help with the local law enforcement, because they won't have to go into those areas also like they have been, because we didn't have enough staff to be able to do it. So.
You're watching In Focus on Whitewater Community Television's WGTV Channel 11. We're speaking with representatives of security at Reid Health, Richmond and Connersville, Randy Clintus, Jeff Kappa, Dennis Perkins. How does this change what you all will do in the event of any emergency? At this point, let's say drugs come in. Somebody on your staff sees someone passing drugs to a patient or something along those lines. What's the procedure now as opposed to what the procedure will be when this is fully implemented?
We are currently able to contain that person and contact law enforcement to get them to respond to help with that. We had such an event a couple weeks ago, and they respond quickly, but we could cut that in half with the officers on scene that are certified law enforcement officers. They could take care of that situation right then and remove it from the patient area and take it down to the security office, and then move to the jail if that's the direction it went. We're currently we're kind of at the mercy of getting that assistance to come out. Always quick, but sometimes not. So it allows us to act very quickly.
Were hospitals finding, and obviously our first responders do a marvelous job, but Richmond is even just touting right now the fact that after years and years and years of trying, they're fully staffed and probably as I say that, somebody's handing in their retirement letter, and they may not be. Has that been part of the issue, just the slow turn? Wayne County Police have also, same thing. The fact that police on the streets have been stretched so far that this has become more of a priority for the healthcare system, or have things changed within the buildings so much that that's why that change really started to take place and that law was created?
I think it's more so the incidents that have occurred in healthcare. Actually, if you would have asked me when I was sheriff what the demographics were for Wayne County on how many burglaries, in what areas we had them, thefts and so on, I could tell you. Mm-hmm. Obviously, coming in new into this, I didn't know that much about it, but when I started researching the incidents that were occurring in healthcare facilities all over the United States, I was actually taken back by the number of assaults that have taken place in healthcare facilities against staff, doctors, or visitors battering other visitors within the healthcare system. So this is not just isolated to Richmond or Wayne County. This is all over the United States. I think you will find that a lot of hospitals all over the United States are actually putting police departments into their buildings for the protection of their staff and for the patients.
Okay. So it's not that you all are on the cutting edge of this, you all are coming to this. You've mentioned that there are other hospitals that have already done this type of thing.
Correct.
Yes.
Does it provide a level of assistance, and you all won't look for it, but will this provide a level of assistance for local police? Where do your police powers, once you have them, start and stop? Are they confined just to your facilities? Or if Richmond, Wayne County called for assistance and a couple of your people were free enough, could you assist them out covering something in the community?
Our scope will be just on Reid properties that are either owned or leased by Reid Hospital and Healthcare Services. We will go to create mutual aid agreements with Richmond PD and IU East, since we are so close with them, and a memo of understanding kind of thing where if they need help, we could at that point stretch out and do that. But the statute or just requires that we have the arrest authority on the properties.
On your property.
Yeah.
Do you see this increasing your staff in the years to come, or are you looking to need to add additional people either here or in Connorsville in order to be able to fill out? Because again, your facilities continue to grow. You continue to have more buildings. Is this going to mean more people added to security?
I would believe so, especially for Connorsville. Connorsville is new, and we're setting things in place there, and it's the hope is that will grow. Some of the services will expand as well. At that point, we're going to have to look at adding staff down there. And here in Richmond, I believe that the potential could be there for adding staff. We have 2 openings, one in each facility at this point. So we still have a couple people that we need. And if we expand much in Connorsville, we definitely need to add staff there. If the security personnel working aren't actually safe themselves, then staff is a little unsafe as well. So we need to make sure the numbers of security staff are there appropriately to handle any situation that we come across.
I'm not going to say that I had a chance to really fully digest this, so I'm just going to ask in our last couple of minutes, what haven't I asked you that you want your communities to know about this process? How long before it's fully implemented? You obviously, you're a former police officer. You've kept up, I would assume, with all the training. You just gave it up. But for how many people do you need to send to this 8-week training period, and how long will it be before you can say, okay, our staff is fully accredited to do what they need to do?
We currently have 24 security staff for Richmond and Connorsville. Right off the top, 5 of those staff should be eligible to become police officers immediately once the process is started. Then we'll have the rest that we'll have to send incrementally because the academies aren't that large, the classes, and they fill up rather quickly because all across Indiana there are a lot of hospitals that already have this program and they're sending officers as well. So I feel the whole process will be at least a 2.5 to 3 year period before it's completed. Initially, I believe we've got 5 right off the bat, and the process will start now that the governing board has approved it. The CEO, Craig Kenyon, will send a letter to the Indiana Law Enforcement Academy, letting them know that Reid Health is going to proceed with becoming a police department. At that point, the academy returns a letter giving basically the okay to proceed, and at that point, that's when everything will start to roll along.
Okay. What else does the community need to know right now about this process and what's going to happen?
I hate to keep doing all the talking, but I've been invested in this for so many years. I feel like I've got some of the answers, but it's like basically you won't see Reid security when we become Reid Health police officers changing that much. Inside, the knowledge will be greater. We'll have a uniform patch that'll be differently. The badge will be different. The care and compassion, and trust me, the guys that you see working at Reid in security carry a gun and they carry a taser, and they're pretty good size. They're still great guys, and they're good men, and they're very compassionate people, and that will not change. 3 of us sitting here will not allow that to change. There's a major difference between law enforcement out in the communities as opposed to healthcare law enforcement, and you can touch base with any hospital across Indiana, and their chief of police will tell you the same thing. A tremendous difference, but yet much the same. The difference is the compassion and the caring for everybody that comes into the facility, because like I said earlier, everybody's always a little nervous, a little upset about what's going on with either the person they're coming to visit or what their condition is. So we all believe in that, and we live that every day. So basically, the public might not see that change.
Okay. Randy Colentus, Jeff Kappa, Dennis Perkins, thank you all very much for being here.
Thanks for having us.
We're going to take a break. We'll be back with more In Focus in just a moment.
The most rewarding thing for me as a spine surgeon here at Reid is being able to restore a patient's quality of life. For every patient, they may have different goals. For some patients, it would be returning back to hiking, enjoying a game of tennis again, or for some people, it's just cooking a meal. When I know that I can intervene and make an impact in their life, that is the most rewarding and gratifying part of my day.
When we look at public health preparedness, we look at the overall health of the community during a disaster. When you look at a public health disaster, there are numerous things that people can do to take care of themselves. And whether that's good hygiene, washing your hands for at least 20 seconds with soap and warm water when you touch things, not touching your hand to your face, but also if you look at a long-term public health disaster, you want to make sure that you have a great family disaster kit available, meaning that you have at least 72 hours worth of food, water, medications, those daily commodities that we need to live off every day. The best thing that you can do in a public health disaster is to stay informed. Listen to your government officials and what they suggest. If there's vaccines that we need to get or medications that we need to get in the disaster, make sure that you have those. But more than anything, make sure that you are educated, that you are prepared, and that you are well informed through the agencies that are helping to help you.
Hi, I'm Sherry Harlan Davis, program host for Reid Beside You. Join us on our next episode, where our guest will be Joy Bolin and Nisha Pandey with Reid Cardiology, and we will discuss Go Red for Women for Heart Month. Join us Thursday, 8 o'clock, Channel 20, WETV.
Welcome back to In Focus on Whitewater Community Television's WGTV Channel 11. We've changed out the players. We're changing the conversation now for something we hope you'll really like. We're back visiting with, and we have visited with these folks previously, but last time we were at their place.
Yes.
This time we made them come to us. Tracy Taylor, Jackie Spiker from the Independent Living Center, thanks for being here.
Thank you.
Caught up with you all. It's probably been a couple of years now.
Yeah.
We were at your place. So start by reminding people, or for those who don't know, what is the Independent Living Center?
Sure. We are a center based here in Richmond. And what our main focus is to empower people with disabilities to remain independent and safe in their own homes. And we do that through a variety of services and referrals. We're a liaison with several different other programs. We can also provide direct items to individuals at times. We serve, my program is the Independent Living Services Program.
Okay.
And we serve any age, any disability. Our youngest is about 5. And I'll let Jackie speak to the other end of that spectrum with her program. But we do everything from work with First Steps and Birth to 5 in the school systems. Okay. We assist families and children with disabilities in their school and academics. We can provide some wraparound services for the family, some just kind of general support and an ear. A lot of times when the medical community has sort of wrapped up their portion of a child being born with a disability, the family doesn't know where to turn after the doctors are done. And so we can sort of step in and say, you know, great, your son or daughter is going to do great. We're here to support you and to support him or her in his or her own life. And we can help, like I said, with the schools. We can assist with housing, but not in the form of providing housing. We can assist them in referring them to agencies for modification of their homes.
Okay.
Or modification of vehicles, things like that, to have a wheelchair ramp in a van, stuff of that nature.
And I imagine I imagine there's a difference if it comes on a person gradually in older age, or if a child is born. There are probably so many questions from the parent side on the front side of this.
Yes, we have found, and understandably so, children being born with a disability kind of hits the family like a Mack truck. Whether or not they have been introduced to the idea of a disability during their pregnancy, or just simply finding out at the child's birth, it can be startling. It can be, in all honesty, it can be devastating, because they have, you'll have certain hopes and dreams, excuse me, for your children, and those hopes and dreams change. So we can be there to support the family through that change and through the transition of adapting to a new family member with a disability.
Okay. Jackie, talk a little bit about your program, which is, unlike Tracy's, which seems to be a little bit broad, yours may be a little bit more in a specific area.
Right. We serve people 55 and older who have vision loss. And we can provide counseling as well as vision aids to people oftentimes who have had sudden vision loss, or, as you said, also who gradually over a period of time have lost their vision and are now not able to do a lot of the things that they really like to do. Reading being one of the big ones, but also just being able to do basic practical things around the house, like being able to cook and operate your appliances because of not being able to read or see the controls. So we have a lot of vision aids that we can help provide to people. And we have a support group for people with vision loss and counselors just to help them learn what kinds of things are available, and they may never have realized, for instance, that there are so many talking things available. We have talking watches, talking clocks, talking calculators, talking blood pressure cuffs, just talking kitchen aids, all different kinds of things like that that we can introduce people to, as well as handheld and desktop reading machines. So we can make all that available to people that may never have known that they had options once they lost their ability to see very well.
Those options from you all and people coming to you, most of your referrals from the medical community, or are most of the questions that you generally get from family members who maybe have been trying to be caregivers and they just have an outreach and they just go, I don't know what to do, I don't know where to go?
Yes, we get a little bit of all of it. Jackie has done a great job in collaborating with the various eye centers and ophthalmologists and optometrists in the area. And so her program gets quite a few referrals from them.
Okay.
And we get phone calls from people who just say, you know, I live in another state, but my mom or dad lives in Richmond. I'm trying to get them support from Nebraska. How can you help me?
Sure.
And so we can kind of be like a little station for them to branch out from and give them ideas and referrals.
And you mentioned Richmond, but you all are tasked with not just focusing on the Richmond-Wayne County area. You all
Correct.
are a multi-county agency, correct?
Yes. Our independent living services program covers, I always have to count these off, Wayne County, Henry County, Union County, Fayette, Rush, Franklin, thank you, and Decatur.
Okay.
And then
Yes.
Jackie's program?
Our program goes all the way down to the Ohio River, south or east central and southeast part of the state. Okay. We have a subcontractor in Vevey, Indiana, who covers 7 counties there. So altogether we serve directly 14 counties, and we spill over a little bit into other counties where we are closer for people to get services than for them to go maybe to the county that would actually be they would be assigned to.
So do you all have physical locations in most of those counties, or is your physical location here in Richmond, but your outreach goes that far?
We have our main office is here, and then our satellite office in Vevey, and then many of our staff they travel and they do house calls. So that is the way we cover the outlying counties. We like for people to come to our office here in Richmond if they can, because then they can sit down at a table and we can bring out disability aids and have them try them and see if they work for them. But if we need to go to their home, we can, and we can take things that are relevant to the struggles that they tell us they're having.
As you have worked with people, and I'm always curious, I'm always asking, are people just finding out about you, the services that you all provide?
Yeah.
Is it well known that you all exist and what you all do?
Well, we're sort of the best kept little secret, and that's one of the reasons we so greatly appreciate working with you here on WCTV to help us get the word out. We are fairly well known with other programs. We do a lot of referrals back and forth and things of that nature. We do have a Facebook page and a YouTube channel, and we are getting some input through those resources. But in general, we still have people that just were like, oh, I never knew you were here, or I didn't know you did this. And so it's always a little bit of an education game too.
For most of what you all are able to provide to people, and again, I've had the opportunity to be in your facility, and I've seen the talking scale and the talking cup and things of that nature that
Right.
you really don't think about
Yeah.
what people might need. What's the cost associated with some of those objects that you all are giving out, and how are people getting it covered? Is this something insurance covers? Is it something that you all are able to do free? Are you all funded by grants? Talk a little bit about how the financial end of this picture works.
Sure. Would you like to?
Okay, sure. We are funded by the state of Indiana to help to people to stay in their own homes as long as possible, because the state knows it's much cheaper for people to be in their own homes than it is to have to go to an assisted living facility or a nursing home. So that's our main goal, and we can make most of our aids available to the person at no cost. We also have a loaner program of the more expensive items, and we can loan those to individuals for as long as the item is useful to them. So some of our large equipment, like the desktop reading machines, the desktop scan and reads, handheld CCTVs, those are quite expensive, and we can make those available as well. People do have the opportunity to pay for them if they can and if they want to, but we can also provide a certain amount every year on what we call mini grants, that at no cost to the individual.
A ramp system like what
Yes.
we've seen, how do you all handle something like that? Do you all work as far as the design, or do people have to have designs done and they bring you this and go, we're looking to be able to figure this out? How does that work? Because again, for a lot, it's the first time they've dealt with it.
True.
And you don't really know what you need until you're there.
Yes. A lot of times folks are just being released from a medical facility after an accident or some incident that has now requires them now to use a wheelchair, and the families are like, we have a house with 3 steps. How do we get mom or dad or grandma or grandpa or son and daughter in? And as Jackie mentioned with the loaner program, we can provide ramps on a loaner basis for as long as needed. And we primarily provide portable ramps, which you just kind of set down and unfold, and then they remain there. We do have a few modular ramps, which are ramps that have pieces to them that you connect. And we can provide those to individuals depending on the measurements needed. We don't necessarily get into the building and such, because that's more or less considered a home remodel or a home modification, and we don't. That's beyond our scope. Yes. You don't want me with a hammer. So yeah, we provide more of the portable ramps, but we go out there and do the measurements and ensure that the ramp would be up to ADA guidelines, which means that it would be safe for the individual to propel themselves up and down, or with assistance from a family member or friend. We don't want anybody going up, a 45-degree angle or anything like that. So,
what does it mean when you're able to keep somebody into their home? What? I'm sure you've seen people who the thought of having to move into a nursing facility or something like that is just devastating. What is it like for you all when you all are able to show someone something that they didn't know existed that allows them to stay where they're comfortable?
Yeah. Well, I think that our mission statement is to empower people with disabilities, and to me, the act of assisting somebody in maintaining their living environment through in a safe way is everything. To me, that is independence. And that can take the form of a ramp, of a reading machine, so that way the individual can read their medication bottles and be safe at home. They can read recipes, look at family pictures, or providing communication devices. We have one little girl who we've assisted with a communication device, and her mom was kind of a little frustrated because she was like, "You need to come take this." And we said, "Well, what's wrong? Is it broken?" And she said, "No, she's fighting with her brothers." And to me, that's independence. She has been empowered to be a little sister and get into battles. So that's that. Do you have stories to share?
Yeah,
I know
we
you
have.
do.
So often, I mean, you don't really often know what kind of disability aids are available until suddenly you have a disability and you need something. So we have had people who have come and sat down in front of a desktop CCTV and discovered that they could read again for the first time since they lost their vision and start crying. And we also have hearing aids, not hearing aids as in the little ones fit in your ear, but hearing amplifiers that can be used even with hearing aids. And we had one man who came in and put that hearing amplifier on and then left the center after his appointment, went outside, came back crying, and when Tracy asked him what was going on, he said, "I heard the birds for the first time in years."
Yeah.
Nice.
So often we have the joy of being able to see people's lives transformed with the equipment that they can get through us.
Okay.
Yes.
Hopefully people will be able to check you out. The
Yes.
Independent Living Center, Jackie Spicer, Tracy Taylor, thank you all both for being here.
Thank you.
Thank you so much, Eric.
We'll be back with more In Focus in just a moment.
The Independent Living Center of Eastern Indiana empowers people with disabilities through advocacy, information and referral, independent living skills, peer support, and transition. We're supported by the state of Indiana, Reid Community Benefits, United Way, Wayne County Foundation, First Bank, U.S. Bank, and individual donors. For more information, give us a call or see us online.
Hi, I'm Dave Paxton, inviting you to join me Thursdays at 9 for Access to the Arts. This edition, we'll find out the goings-on at Civic Hall and with the Richmond Symphony Orchestra. We'll also find out how the performing arts are helping to preserve the Reid Memorial Presbyterian Church.
The space is beautiful. High ceilings are always good with acoustics. One thing that appealed to us with using Reid, especially for the choir concert, is having access to an organ.
Thursdays at 9 on WETV, Channel 20.
Hi, I'm Eric Marsh, Executive Director of Whitewater Community Television and your host for Eastern Indiana Works. Join us this month as we meet some of the staff at Eastern Indiana Works.
Add value to that employer. So we have some programs that are really cool that has helped out several employers within Region 6.
We'll help you. We can get you back out there. You need to have a job. You need to work.
Eastern Indiana Works, Tuesday evenings at 10:30 on WETV, Channel 20. Welcome back to In Focus on Whitewater Community Television's WGTV Channel 11. I'm Eric Marsh, Executive Director of WCTV. Glad you're able to join us on this evening for our In Focus program. And we've once again changed the people in the seats, and we're talking with Terry Short, Nurse Practitioner and Clinical Director, and Lucretia, did I get it right?
You did.
Okay. Whitley, Quality Manager of the Neighborhood Health Center. Let's start by, for those who don't know, where is the Neighborhood Health Center?
We are located on the corner of South A and 10th, 101 South A Street, or South 10th Street.
All right. You all have been open for how long now?
Coming up on 2 years. Actually, we're getting ready to have our 2-year anniversary in April, so we've
You going to throw a big party?
Absolutely.
Okay. Federally qualified health center, for those that aren't familiar with that term or connect it someplace else, what is it that means for you all and for the patients?
Federally Qualified Healthcare Center is a designation that we get from the federal government. We have very rigorous guidelines that we have to meet for that. So part of my job as the quality manager is we watch a lot of different quality metrics for our patients. So as we discussed earlier, we are looking at things like hypertension for our patients, making sure that that's well controlled. We're looking at their diabetes, making sure that's well controlled, and then making sure that they're also getting those preventative measures such as colorectal screenings and pap smears, mammograms, different preventative services as well.
Okay. We were actually in the facility just under a year ago, talking to Carrie Miles, the director, had a chance to take a look around the facility. One, outside has changed. There was a lot of construction at the time. How has that made a difference for you all and for your patients, having that done?
It's made it so much easier to get access to our clinic. We have a lot of patients that walk. We serve the southern part of the county where we're at. Well, we serve the entire county, but our patients in that area can walk to us. When the streets were under construction, it made it difficult for them to get in, but we have full access now by walking or driving to get there.
Neighborhood, and you all are talking about that's where a lot of your patients do come from. Not all, obviously, but that's where a lot of your patients come from. What is that like, finally having you all there? What have you all heard about your presence in that neighborhood and the difference that you all are able to make in people's healthcare lives?
I think just the access to care is huge in whatever area that you live in. But for the population that we serve, a high percentage, I think around 80%, are actually within walking distance or several miles for us. And so that makes a huge difference if someone has transportation issues, so they're able to actually walk to the clinic instead of having to find a way to a different clinic which is farther away. And one of the things that we're able to offer as a federally qualified healthcare center is transportation assistance. So we're really happy to be able to offer that to patients as well.
When you say transportation assistance, you have a van, you pick them up, you do vouchers for
we
transportation?
utilize public transportation in most cases. With the bus route, we are right on the bus route, and we have a stop right next to us, so that's been very nice for patients. There are some that drive that we can help with gas cards, and we also use taxi services as well.
Okay. Since we last had a chance to talk with you all, you've expanded your locations and actually gone outside of the county. You're in Union County is where you're set up. Talk about that location, talk about going into there, and what was the impetus behind making that move, as opposed to expanding somewhere within Wayne County, going outside the county?
Well, we are also able now to help serve our patients to the south of us and Union County Medical Center. It's enabled us to provide services that were not there before. We incorporate many different services that other offices don't have. You know, we have mental health practice on site. We have medication assistance. We have, like she was speaking of, transportation. We have access to immunizations, and the services that we can provide now, not just in Richmond, we're also in Liberty. And it's expanded the needs for our patients, you know, to provide what they need.
What were you all seeing from a financial and medical need in Liberty, in that Union County area, that made you go there? And the things that you were talking about, transportation services, being able to walk to where you are those things still available there? Are you in that neighborhood type of area where you are in Liberty?
Not the exact setting. Liberty's a lot smaller of a community. It definitely is still within a walking distance for those that live in town. They don't have a taxi service or bus service there, so we utilize the Union County Transit to help with transportation services. But I think anytime we're looking at expansion, we're always looking at where we're going to make the biggest impact. And Union County was definitely an area that we could look at that needed more access to care and some of the services that we can provide.
What specifically are you all able to do there that they weren't seeing?
Some of the services that Terry had mentioned earlier, with additions to, we have a diaper service there that we can give diapers to those mothers that can't afford that. We also have a formula service there too. We can get the mothers in contact with the formula reps. We have free samples that we can give to them as well. Medication assistance, as Terry had said earlier too. So it's nice to have that wraparound service. We have care coordinators that track our patients that have chronic disease processes as well. And that's been, I think, a blessing for them as well. So we can make sure that they stay on track.
What kind of reports, what kind of information do you need to provide? Because your federally qualified health status is something that has to be renewed periodically?
Yes, it is, and we submit data each year, and that'll be coming up in February. So we're actually right in the middle of getting that data all together and submitting it. So part of my job as quality manager, we mentioned that we watch several clinical quality measures, and those to make sure that the patients are meeting that criteria, or if they're not, what we can do to give them wraparound services to meet those. But we also have to put in patient demographics, so what zip codes that we're serving, federal poverty guidelines where they're coming at an income versus household level as well, diagnosis. There's many things that come into being a federally qualified healthcare center.
Hours for folks that may just be hearing about you, and you think we've been there for almost 2 years, everybody knows we're there, and that's not always the case. So give us some of the basics that people need to know. If they're thinking about using your services, what do they need to know financially about themselves that would allow them to use your services? What do you need to know from them? What do they need to bring in with them for the first time? And how do they even start by getting an appointment?
At our office, we try to make it pretty simple. We do have an intake paper that just helps guide us with what the patient's needs are. They can call in, we can get the paperwork to them. We're accepting patients now, so it's not that we are just saying, yes, we'll see you, no, we won't see you. We'll see all of our patients that are coming in. We may need to have them set up with one of our financial assistants who can look at their income and put them, decide if they would qualify for assistance from us. We also have claim aid on site as well that can help if somebody doesn't have insurance, help them apply for Medicaid, the HIP services. We do have that on site as well. So if they are going to come in, they can make a phone call, get our information, we can get them set up with an appointment. At the same time that they come in, we can have them meet with one of our financial representatives so that they're not walking in blind, not knowing what they're going to need up front to become a patient.
Are there certain issues in the neighborhoods and the areas that you all are servicing that you're seeing more than another? Are there certain things that just really kind of jump out that says this is an area we need to be in? I mean, you all did some checking before you went into Union County. You all do your research. What are you all seeing that makes you say we have to go there? We can really make a difference. There was a reason you all set up where you did.
Absolutely.
What were those, and are you seeing, even in 2 years, even in what some would consider a relatively short time, that you are making the difference you thought you would by going into a particular area?
I think, some of the primary things that we see is we see a lot of patients with diabetes, and diabetes that's been out of control for a long time. Hypertension that's not under control. We have a high population of people that smoke in the Richmond area, so we see many patients with COPD that need to get their breathing under control. And if you look at some of our statistics, which Lucretia can give you better information, our numbers for diabetes management are probably some of the top in the state right now. Hypertension management, I think we're number one in the entire Ocean region for hypertension management. So we're making a big impact for the patients that we see right now. We do see a lot of patients with depression in that area, and having mental health services on site. We can actually at times do a warm handoff. If I have a patient that is in a mental health crisis and one of our counselors is available, we can see them and I can take them straight over to a mental health counselor and start establishing services for them as well. At the same time, it's not we'll send you out and try to get you an appointment sometime. We can actually do that handoff, immediately and help patients in that manner.
Are patients talking to you more about what they're feeling, what they're seeing, and what type of difference you've made by being where you are? Are they expressing that? I mean, you're seeing it in their numbers, but are they feeling it? Are they knowing it?
I think they are. You know, our patients, we listen to our patients, so we hear what their needs are and we see what their needs are. And we don't treat just a diagnosis, we treat the whole patient. And, you know, whether their needs are financial or their mental health needs or their physical needs, or, you know, if they come in and they have nothing to feed their babies, you know, we take care of that. You know, we have formula, and we even have clothing if patients need clothing, and we see kids come in without hats and gloves, and we put hats and gloves on these children. So, you know, we look at the patient and the family as a whole, and, you know, we try to help with all of those needs, not just a specific diagnosis.
And I think a patient testimony is one of the greatest things that we can look at. Like you said, we can see it in the numbers, we can see it in the data, but when you see it from the patient, and when patients are referring friends to us and they say, I'm getting taken care of here, I like the community that I call my provider and my MA that comes in, and our facility, I think, is different from some that you'll see where you are greeted at the front and you truly are family when they come in, and each one of our employees that touch them know their story and are interested in hearing how they're doing the next time that they come in.
What's a phone number if someone needs to reach out to you all?
965-4299 will get you right through our 10th Street Clinic. They can call there for an appointment. If they're closer to the Union County office, they can direct them at that time, but they can get an appointment by calling that number.
Okay. Ladies, thank you very much for your
Thank
time.
you.
Thank you
Thank
for
you.
the work that you're doing in the community. Terry Short, nurse practitioner and clinical director. Lucretia Whitley, quality manager. Thank you all very much for being here. Greatly appreciate it.
Thank you.
Thank you.
I want to remind you that you can still get registered to vote. Registration can be done easily at home. IndianaVoters.com is definitely the way to go in order to be able to do that. If you want to do it in person, because sometimes people just like in person, you can do that 301 East Main Street. I want to thank the folks at G1013 and 1490 WKBV. They're also 100.9 ESPN Radio for airing the audio of this program. We kind of gloss over that sometimes, but we want to throw them that. Next week, we'll be speaking with Derek White from the Housing Authority for the City of Richmond. Thanks a lot for watching this week's In Focus on Whitewater Community Television's WGTV Channel 11. I wish you well.